Imagine a medical treatment that, well, it sounds a bit like science fiction, doesn't it? Breathing pure oxygen in a pressurized room.
Right.
But its story, particularly here in South Africa, actually goes back decades with some pretty surprising twists and turns.
Absolutely. And that's what we're diving into today, the history of hyperbaric oxygen therapy, usually called HBO, right here in South Africa.
We've got some fascinating source material to guide us, tracking HBO from its very first appearance up to where it stands now.
So maybe just a quick refresher. HBO, hyperbaric oxygen therapy, essentially means breathing 100% oxygen inside a chamber that's pressurized.
Usually somewhere between 1.5 to 3 times normal air pressure, right?
Exactly. And the whole point is to supersaturate your blood and tissues with oxygen, way more than you could get just by breathing normally.
Our mission for this deep dive, then, is to unpack how this therapy arrived, how it developed, the key moments, the people, the organizations, the whole story in South Africa.
And you know, what's really interesting is that the initial reasons for bringing it here weren't quite what you might expect today.
Oh, really? So where does the clock start on this?
We're looking at the early 1960s. That's when the first units arrived. 3 big state hospitals, Groote in Cape Town, Addington in Durban, and National Hospital in Bloemfontein, they all got these Vickers monoplace chambers.
Monoplace, so single-person units.
Yes, just for one patient at a time. And they were radiotherapy chambers.
Ah, radiotherapy. So the first thought was connected to cancer treatment. This is where it gets interesting.
Precisely. The main goal initially was using that pressurized oxygen as a radio enhancer. The thinking was, more oxygen in the tumor makes radiation more effective.
Okay, that makes sense.
But as the research on that specific application kind of evolved, the clinicians here started noticing other potential uses. They began exploring empirically.
Empirically so, based on what they were actually seeing work. Like trial and error almost. What sort of things?
Exactly. They started trying HBO for conditions like radionecrosis, that's tissue damage from radiation, and also severe infections, sepsis, and those really difficult chronic wounds that just wouldn't heal. And around the same time, actually in 1961, Pretoria Academic Hospital got a Vickers hyperbaric bed. They used that for some very serious stuff. Gas gangrene, osteomyelitis.
That's a nasty bone infection.
A very deep one, yes.
Yeah.
And also for septic non-unions, where broken bones with infections weren't healing. And again, problem wounds. Unfortunately, that particular unit got damaged and eventually scrapped.
Wow. It's kind of wild to think about those early days. Who was installing these things? And training people. It sounds quite specialized.
Well, a local private company did the installations of those Vickers chambers. They provided some initial training, too.
But was it comprehensive medical training?
Not really. It was pretty rudimentary, mostly focused on just operating the chamber and basic safety drills. And what's really noteworthy is that in those very early stages, there wasn't always direct medical supervision during the actual treatments.
Really? Who was running the sessions then?
Often it was nurses or radiotherapists administering the HBO.
That definitely shows how early it was. A steep learning curve, I imagine, figuring out the best practices and potential pitfalls.
Absolutely. And things continued to develop. Around 1978, Johannesburg General Hospital got 2 Vickers clinical hyperbaric systems. But this period also, unfortunately, highlighted the urgent need for stricter safety.
Why? What happened?
Well, tragically, one of the Joburg chambers was destroyed in a fire. The exact origin wasn't clear, apparently.
Oh, wow. Was anyone hurt?
Thankfully, no fatalities. But it was a huge wake-up call. A stark reminder of the hazards, working with pure oxygen under pressure. It really hammered home the need for much better safety standards.
I can imagine. What happened to the other chamber there?
That remaining one fell into disuse by about 1986. And it's quite something when you think about it. Of those original 7 Vickers chambers across the country, only one is still running in its original form.
Where's that?
That's the one at National Hospital in Bloemfontein. Still treating patients maybe around 48 a year, something like 1,400 over the last 30 years, according to our source. It's kind of a living piece of that early history.
A real testament to the technology, if maintained. So that covers the initial state hospital phase. What came next? Did other sectors get involved?
Yes, a really crucial parallel development involved the South African Navy.
Ah, okay. Makes sense for diving medicine.
Exactly. In 1965, they installed a small Draeger multiplace recompression chamber. This was at the Institute for Aviation Medicine.
Multiplace, so more than one person.
Yes. And its main job, as you guessed, was treating divers with decompression sickness, DCI, or the bends.
The classic application for hyperbaric chambers, was it only used for divers?
Primarily, but not exclusively. It was used sort of on an ad hoc basis for other things too, like multiple sclerosis and radionecrosis cases, echoing some of those earlier empirical uses in the state hospitals.
Interesting. So still exploring a bit.
But then came a really significant shift in 1993, under the direction of the author of one of our main sources, actually. The facility started providing a regular hyperbaric therapy service.
So moving beyond just emergency diving cases.
Precisely, expanding its role. And that really set the stage for the more modern era. In April 1996, they replaced that original Draeger chamber.
With something bigger.
Yes, a much larger, locally built six-person chamber. Apparently, it had a nickname, Miss Piggy.
Miss Piggy. Okay.
And that facility, with Miss Piggy, became a real engine for the modern evolution of clinical HBO in South Africa.
Yeah.
It allowed treating more patients and, importantly, developing more standardized treatment approaches.
Okay, so we have the state hospitals starting things off, the Navy developing its capabilities, but it sounds like things were still a bit fragmented, maybe. What about bringing it all together with proper standards and guidelines?
You're absolutely right. That's where the 1990s become really pivotal. A key moment was 1992, the formation of SAUHMA, the Southern African Undersea and Hyperbaric Medical Association. Basically, a group of doctors interested in both diving and hyperbaric medicine got together.
And they became the driving force for standards.
They did. In 1994, they affiliated with the UHMS, that's the Undersea and Hyperbaric Medical Society, the big international body.
Right.
So SAUHMA started adopting UHMS recommendations, their list of approved conditions for HBO. They became increasingly central in establishing both medical and safety standards here in South Africa. They even started hosting international conferences every 2 years.
So knowledge sharing, best practices.
Exactly. This group really shaped modern HBO safety and practice here, building that foundation.
What about training? If standards are improving, you need people trained to meet them. You mentioned the early training was basic.
Another critical piece. Now, the Institute for Maritime Medicine had actually started a course way back in 1972, the Diving and Submarine Medicine course.
Okay, but focus on diving.
Primarily, yes. So for the broader clinical applications of HBO, a dedicated program was needed. That came in 1997, developed at the Institute for Aviation Medicine, the Diving and Hyperbaric Medicine Staff Training Course, or DHMSTC.
DHMSTC. And was that course well regarded?
Oh, very much so. It was presented over 18 times, here and internationally. Crucially, it got UHMS approval for CME hours, continuing medical education.
Important for doctors.
Very. And it was also accepted by the NBDHMT, that's the National Board of Diving and Hyperbaric Medical Technology in the U.S., as meeting the academic requirements for their CHT exam, the Certified Hyperbaric Technologist.
So it really helped professionalize the field.
Definitely, ensuring a higher, more consistent level of expertise.
And around this time, did the private sector get more involved too?
Yes, significantly. That same private company involved in the early days took on refurbishing and reinstalling 3 of the remaining old Vickers chambers.
The ones that weren't scrapped or still in original use?
Correct, and this led directly to the first private HBO facility opening in South Africa. That was in Pretoria, March 1998.
A big step for accessibility, I'd imagine.
Huge. Suddenly, this therapy was available outside the state and naval systems. And following that, more private centers popped up. Pretoria got more, Durban, Cape Town, even Welcome.
Which must have made those standards SAUHMA was working on even more important, right? With private clinics opening up.
Exactly. You needed consistent quality and safety. And that led to another landmark achievement in the year 2000.
What was that?
The South African Bureau of Standards, the SABS, published a national standard, specifically for safety and quality in clinical HBO facilities. This was done with guidance from SAUHMA, particularly Francois Berman mentioned in the sources.
A proper national standard. That's huge.
It really was a major step to ensure minimum safety levels and training across the board. Considering the early days, the lack of training, that fire incident, it underlines why these formal standards were so vital, not just for efficacy, but for basic safety, preventing accidents.
Okay, so that brings us into the 2000s. Standards are in place, training is formalized, private sector is growing. What's the focus been since then?
I'd say a major focus has been on gaining more academic recognition and continuing the growth in clinical use. A big step was in 2003. The University of Stellenbosch established a dedicated division of underwater and hyperbaric medicine.
Embedding it within a university structure.
Exactly. Led by Dr. W.A.J. Jack Meintjes. They developed honors-level courses, BST Mandicurants, in diving and hyperbaric medicine that met all the key international training benchmarks, DMA, EC, EDTC, ECHM, ECB, all the acronyms.
Impressive. Proper academic integration.
And there were plans detailed for master's and PhD level programs too. Plus, Dr. Meinches and the author of our source worked together, collaborating with European bodies like ECHM and ECB to create a comprehensive web-based postgraduate education program.
Online learning, making it accessible globally.
That was the goal, using platforms like Oxynet to make this specialized knowledge available worldwide. And generally over the last, say, 20 years, we've just seen this steady increase in acceptance and use of HPO for a wider range of conditions in South Africa.
Has it all been smooth sailing, though? I mean, getting funding for treatments like this, dealing with medical aids, that can't be easy.
No, you're right. That's been a persistent challenge. Getting consistent funding and coverage from medical aid schemes is often difficult. It's an ongoing issue.
But there's been progress.
Definitely. There's a growing body of evidence for HPO's effectiveness in certain areas, and doctors are becoming more familiar with it. So there is growing support. And importantly, this has helped HPO services return to academic hospitals. Pretoria, Stellenbosch, Bloemfontein are mentioned.
Coming full circle, in a way.
In a sense, yes. And it's crucial to remember HPO is still listed as a prescribed minimum benefit, a PMB, in the Medical Schemes Act, but specifically for treating gas gangrene.
Okay, so mandated coverage for that one life-threatening condition.
Correct. Which really shows its recognized value in that specific critical situation.
So if we step back and look at the whole picture, HBO in South Africa started with those early, almost experimental uses linked to radiotherapy in the 60s.
The Vickers chambers.
Then the Navy played a key role, especially with diving medicine, but broadening out.
The Draeger, then Miss Piggy.
Followed by that really crucial phase in the 90s, establishing SAUHMA standards, proper training.
Aligning with UHMS, the DHMSTC course, the SABS standard.
And now moving into greater academic integration and wider, though still sometimes challenging, clinical use.
That sums it up pretty well. It's been a journey from, limited availability and quite basic protocols to a field with recognized safety standards, solid training pathways, and growing acceptance in both private practice and the state health system.
It really has been quite a story to unpack, and considering this whole history, the South African journey, it really makes you wonder, doesn't it? What does the future hold? Where might HBO go next in terms of applications, accessibility? Not just here, but maybe globally.
That's a great question, and maybe something for you listening to think about. It's clearly a therapy with a fascinating past and potentially an even more significant future ahead.
Absolutely. We definitely encourage you to dig into source materials if you're interested and just mull over the possibilities for this unique medical tool.